All right, Mark, thank you so much for that. Eyewitness News is your vaccine authority. Today, a big announcement. Pfizer announced their COVID-19 vaccine is effective in kids ages 12 to 15 years old. It's big news for parents. A lot of them want to know about this. Joining us live now is Dr. Onyema Obuagu, infectious disease specialist at Yale Medicine. Doctor, thank you so much for being with us.
Thank you very much for having me, Irene.
So this is a very big announcement, as all parents know. We hear that you were one of the doctors involved in this Pfizer vaccine trial.
That is correct. So I was the principal investigator for the Pfizer vaccine study, both for the adults and the kids. And yes, we are all just beyond over the moon and excited about the results that were just released today. Again, just want to be clear, these are preliminary results, but just the finding that the vaccine protected 100% of the kids that were vaccinated, because there are 18 cases of COVID-19 and they occurred only in the kids that got the placebo or the sham vaccine as against those who were vaccinated. And add to that, the vaccine was safe, very well tolerated. And it's just great news for kids.
Yeah, great news. And it's 100%. That's a much higher percentage than even in the vaccine approved for adults.
That's true. I mean, it's hard to compare, these trials one to another because we know that there's circulating variants now that probably weren't around when we did the studies in the adults, and also that these are preliminary results. But regardless, I think, the 95% efficacy in adults and now 100% efficacy preliminary data for children aged 12 to 15 is just beyond welcome news. And just that guarantee that when people receive the vaccine, that they have a high level of protection against getting sick from the virus is just amazing development.
What should parents know? What's the big takeaway for parents? I mean, a lot of them have questions still about giving their children this vaccine. What would you tell them?
This is just green light for the vaccine safety and efficacy in that group, and also allows us also to then study the vaccine in even younger kids. So we're already working on kids 6 months and older, so through age 11. So we're going to hear more about some of the studies sometime in the future. So again, I think it's great that children can be vaccinated. It does have implications for just the level of confidence we have with them returning to school safety around COVID-19, maybe even resuming sporting activities that we've all put on hold since COVID-19 hits. And also because it also increases the population that's eligible for the vaccine, then that makes it so much easier to achieve herd immunity, which would be what we would require to have much less cases of COVID-19 circulating.
All right, I'm sure we'll be talking about this for a very long time. Thank you so much for being with us. We appreciate it.
It's my pleasure.